It's a call last one. Pastor Ubia, who we are, for Ubia, only the DBA friend, or no, me friend. And yes, it's away. Sister San to my way. Sir. No. Obi nsu fra ne dia wo chia no kura okoyi ne san pentuma ne nyina hwiegu ne uya na dia ka me pa cho mo hwe entuma kese e na odi fra Watch him. What we are going to so. Obe pumpro na guso. Obe pump. Omba mo nsema no. Okay. Dio France sia na no o mo de ko patanto. Who have you penny now of us for her na de bia ntuma say ya. We so o de dia wale a on kasa nche kura na de na ma. Ba cho mo hwe o. Entuma no so. Okay. No. Momo musemano. Afi, mema ni bimbra. Mema ni bimbra mejina yenhwe. Mr. Justice. Any other says so what you to man me no ana ba ko beso. What pa. Where Obi Debuya na ya Obi Hanky no. Pia, nana. Ukuro mpohu o maka kai yanga se befa. Mama. Ubu otiko sa na kese. Level na o pem du anu aja. Ah, tu anu so. When you do have one function. Bate bura. Ko na edi en tu ni. Ela me vê lá com o time. Mas e en tu? Pia. Wow, beautiful. Why be you never? Ebra na eko. Why be you? Kente bi ene ha, obi ene kente. Me pa cho mo hwe, e so fon so kire ne de. Five. Do 5 on swap. Not what measure could see. Okay. Kente no wachire no nyensa asawa bia na de kente wa ya kire wade a ohu no video na ada obenya ntoma na wahwe u play ana wohwe bonsem mano we ufira na wa na ntu ya wona mo yesi pia nso na uni kapre na ye pia Any of a book a traffic way, Anna. Oh, okay. 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 Uta comment share him fear na who be pa him for non to ma mu fira pa no. Why are they? Mumba mun sem masofo. Ya de besia embo yen sem mama mpanifo yi pa se o mo ya de na on se ntuma fira de enimonyam wo mo wo ko ba bi na wo fira ntuma treatment ni different kra echen mo mo hye ntade ya de ka bompa ye awie dada enti ene se de adwuma no esitie no eye nkyerɛkyerɛ a ya de ba ba ma titiro ne mema nti mba mo ha no so madaro ma muntie bi na ukofia ukunu wele fia na wakae no sɛdeɛ mɛma no yɛkyerɛkyerɛ yɛ sɛ muntie bi ma mo yere no no titiro ne kɔkora mo ɛtɔ mo nufu mu no ya ne yɛtaa tu mɛma no fo sɛ mɛma no ntie na wokɔ a waboa wo yere ama na hwehwɛ ne kɔkora enti ma na ɛwɔ ha no so yɛbɛsrɛ sɛ mo so mbɛtie na mo so mo kɔ a maboa mo kunu no ahwehwɛ wɔ mo kɔkora enti ɛna dwumadie no ɔpani a yɛnsa ɛka no a obeboa na wa kyerɛkyerɛ yɛn ɛwɔ yade na edi enya pa edi enya na nso ɛmɛ sɛ wohunu na wo hyɛ ase tu ho na montem na ehu akyi wade ya wotwe ho firi ho sɛ de adɔkotafoɔ de ma yɛ no ɛbɛboa ama ɛkyina bi no ɛnkonkodum pɛmpɛnsuo bi a na woyɛ wo ho hwe a ɛnyɛ yie ɛno nti ɔdɔkota Dr. Faid Ahmed Abdallah wono nene obeboa yen na wa kyerɛkyerɛ saa ne mai enti mehwɛ me brɛ no a ɛkwa ne saa enti amfa nsɛmbo yinhyia Dr. Faid Ahmed Abdallah awɔyɛ internal medicine resident wɔ konfa no chiaban ya sabia na omeboa dɔ kwada roma wo de no bɛka twia na abrɔfo obemix ene ye no ano no kwada roma.
Good evening pacham hoye sena ochichim na efeme Dr. Ahmed Abdallah near the medical doctor of Confanoche, internal medicine department. Now, more 2 weeks, 3 weeks ni, and I mean ya kufida mwa. I'm in no school Ukraine. I'm in chance minya. A friend say, na munya education on prostate conditions. Of course, actually, because you may busy there and so me pana more minya time. My baha, I be teaching natural amount for. In Instagram, me buy. Before you be shasi, when you say, "Mema baby wa ma so wa ha," we a condition I affected mema, but man also name baby a more so musu free prostate issues, or also more take mema say in a way. And before say be shasi, prostate conditions and affected young people. Usually it comes with advanced age. You know. Now they know we have prostate issues in India. There are other risk factors that can happen. And yeah, there will be a case where the 20, 30 when you have prostate issues. AC something to be questioned. Before I say I can say this. What do you know about prostate and prostate issues? Now, if I'm be a medical because you are answering your chassis. Send I don't know be a share free. Anyone? Okay.
Yo, doctor, kakra mate ene se ese emerima na enya sa yare no na omo se ye wo druben bia ewo emema eho a etimi mmoa anase etimi kese na wode ene mmoa embema untimi enyo so papa ha ena se emmoa sa so etimi ma Johnson no kura ka omu a entimi ma abonten na ma wa yase ayere tai se kese nso a wote ho a Johnson no bakura wunhu de me kakra mate enam.
So it seems like our pastor more information on prostate conditions. Because as a man, you have to read wide on because you know the things are among for baby and also who address yourself with it. And Tebesha say with answering this question, what is prostate? So now, Pastor Chichi, prostate, organ be a pelvis. I say it's your honum baby. Any, I say, how do you say, Bessin? On send a bessit, you know, kitty bessit. Sana no suit, in the orange way, only. Any prostate no. Baluna, a was rui. Baluna, a was rui. Ohana, Ojonso, Ejina, kidneys, me, no bakoaha, and a bakoaha. Kidneys bakoaha, and a bakoaha. And I your pipe here, your collective kidneys no two. Baluna, away. Into kidneys no filter, Joneswa, na balloon muha. Na balloon muha no. You are another pipe here, you connected about Bayman, Mamma Johnson yet. Eba. Into any time Biana, Johnson Baha, Eba, or say you fool. Into your fool say balloon. Send the message actually what you say, Upaso Johnson and Sana, Mazels now contract Sama Johnson Johnson Abba. But I said, prostate no so, baby I wanna, I say a gate, in fact say, is surrounding the urethra, Ewaha. So the prostate is surrounding urethra at this region. And one main function. Minimum say in a man in sperms. Sperms no. Your white part be a milk and other white part is in you. The white part now is in you no. So air no. And no na prostate we air then produce you. The science you fit is produced from this prostate and as sperms nankasa it produced from her testes or show a honum. Now show an produce here now about epididymis na a store. Into hoba na a fat tube na befa na befa baby a prostate no one. And sana if you be me waba. Into a hana take one if you back. Into a baha na be share in sodium no seminal fluid no na a lubricate no amana den about mountain. Pachamote I say. At this point, any question before some because one two I say you do any more I want to say into a question or hand will be Samame. Any question? No uncle. Send ye old children. In person, we go into details. Send ye I be deviating free. The air can want them, but muscles view or ha. I a friend of pelvic organ muscles. And they control say on Bebantem and I on the emantem. So a real weaker Maunia premature ejaculation. Sorry, I know Hoba. Sorry, I know Hoba. Into my aim, Sana and my own debating cause our pattern. But besides, yes, say prostate no a producing so be a mixture with sperm no a man about one tewaha. Now prostate no so as around the baby a urethral Jones on so free bar. Sending I boom symptoms of prostate conditions in this animal and sending I bet say most importantly, baby a Johnson heading a free no. Free bladder hano have tube hano. Johnson free about on the prostate in surrounding no into a funny PV. Oh, into bibia ka prostate na sa tube na free blood and elko urethra no so be affected. Oh, akakọ esa gata. Odi bitu ma be den e be chuki. Nso ni ntimi nko se ne e wo se eko. Ana asa gata na bu nchen na. E be block. Nso ni ntimi nko se ne eko. Ah na we sutie. Pacho mo ti ase. Okay.
Okay. We have a question. Also, it's like tube back up sperm FMBA and Johnson FMBA. Is there any time it will crash here?
So no,
because from experience kakra menya in terms of prostate asemia, it was a point in time. Obenya sperm no time bedru unya nti pese me hunu say Johnson a block we na say what happens to that junction say universal cross na one
universal cross what you nti ni na entimi see at the same time. Oh, so who ba Johnson en know that so who be we me later na Johnson adeo benim say one notice we so a say Johnson kwa adeo na maybe only like wife is here we share na ho ba after that ko Johnson am say eye we ya pa benim say more experience adeo na exactly because say sperm ne ba oh e bi be ka urethra ni mu oh nti o Johnson akwa say bibia achoki kakra bia e kushiba nti na o feel pain na kakra nso pacha what you say. Aha, exactly. Good. Inti at the same time. Bakoba and Sana Bakoba. There can be a condition which my for me send ya ojo so kwa na sperm so the air back. No air abnormal, but normal physiologically in sisa. What you say? Aha, that's it. Any more question before we continue? Okay. Prostate nankasa. Prostate nankasa organo enye yare o. E ka say prostate CA ana prostatitis ana BPH ene yare e beba aka ho asem ba prostate nankasa organ ate se e ka say wakoma wo ho. Nti wo akoma ne se wo akoma yare. There be prostate na yare e wo ho a e wo the function and the function am achichim say produce nsu se ne abelubricate sperm ama na ba.
Let's say ade Nyankopon de ball bema.
Ade Nyankopon de ball bema. But on so ba na e feel say we prostate condition or prostate issue. Say na say maybe obi or hypertension affecting akoma ka say when heart failure. Wo akoma ne dey by say heart failure na a condition fufuro. So prostate na dey awo. And you say abnormal thing wo bia na say asem. We betima wo ho nya prostate o ma we nyini a onya ho condition bia. Nti be chichima kire senior amount for our more risk factor to getting prostate. Let's say any money, man. That's what I say. Any question before we continue? Good, no question. So these are some of the common conditions that affect prostate. No. Maybe introduce a medical term. Kakre bisani abiya anti asiye. So I can say ubianya prostate enlargement. A general term that means say prostate na eden I can see than the normal size. Sene means it one say normal but condition which we have na I can see who means I because we dey eden I can see. So na prostate no sit here. Say on the size that the size near be about 30 grams baby. But e be can see then abnormal. E will say who dey eden e man here eden e can see. It say infection na ba na man I can see ana say no na e say can see ana say cancer bia be man and I say abscess be abemana, and they will say conditions that affect prostate. Bakumin say we are the most common by a big home. Apart from enlarged prostate and benign prostate hyperplasia, it's not actually synonymous. Because of people say allergy, and then say benign prostate hyperplasia. Which back say ubi or benign prostate hyperplasia only say a biopsy. They will be below prostate. You will be found to honor. Near what prostate me and TB near their collab, near a microscope, near a say I enlarge cells and I can say near case a day benign prostate hyperplasia. But only years I test and I want to make us a BPH because a prostate what enlargement. That's what you say. So prostate enlargement it can be the BPH or it can be a prostate cancer. The only way you can know the difference between the two is this a biopsy. You two. Oh, I did it. You need a shot or two on them. Need a me and I bought two near tribute near the collab. No mushroom pathology for no mushroom. These are the common ones. You better back. I started with the common one, the prostatitis. Prostatitis, a medical term. Prostate, P-R-O-S-T. P-R-O-S-T is prostate. Itis in medical term means inflammation. Maybe an infection, I inflamed. There is immune response. So prostatitis, inflammation of the what? Of the prostate. Intidena, etuma prostate inflamed. So the common things are etuma prostate inflamed what? Infections. Usually sexually transmitted what? Infections. Even then chlamydia, gonorrhea, and I said maybe your friend is saying procedure be prostate biopsy in America after the procedure it's inflamed and also causes prostatitis. But the most common one without any procedure then sexually transmitted infections, say chlamydia, no gonorrhea. That's what you say. And the balance I didn't know feel it. Once Ojon Swa and we are no bad data on whole background, spam neighbor won't say a maybe why I shake a crack and I sign my name on hand. And then of course inflammation of the prostate. Say inflamed the air can see and also between my prostate conditions and our prostate enlargement symptoms nippy. Pachomatia say. And you say you better a large prostate, a benign prostate hyperplasia and prostate C, and discuss it into details. Please, any question at this point before we continue? Send your questions in number time. Any question before I continue? No question. Thank you. I think that we all understand this point. Okay, so now you can say benign prostate hyperplasia. We can only say there is benign prostate hyperplasia. This is cells under microscope. They won't say I can say the same way they won't say cancer. This is a microscope. When show a microscope, more intimate we cancer that. Pachomatia say, you have to have the evidence that we are cancer and we are cancer. So benign means in Latin means what? Non-cancerous and yet cancer. That's what benign means. Prostatic, and I can say relating to the prostate hyperplasia. There are more cells than normal. Or increasing what in number. Pachomatia say, So commonly known as prostate enlarged means the prostate gland has grown larger than normal, approximately 1.5 inches in diameter. So now, image we are made out to way. So prostate no kesia. Say kesia. Prostate no so you divided into different regions or regions based 4 or 5. But the most parts now enlarging parts now close towards to the urethra tissue now Nti enlarge a unse sa tube no na den emia no. Pachomatia say nti ahanom sa tube na hano say ha enlarge a unse emia no ba. So the more it enlarges, the more den close no. Nti enlarge kitu bi a be close ni kitu bi say enlarge kese a na be close no more. Nti no we feel symptoms no more. Nti say enlarge na close a symptoms be na we feel. Nti you follow me and look at so me medical doctor for you to understand this. Say close a we feel say Johnson I wa na ebeba. Embada I so got ahead achuki no. Pacho what you say. Nti symptoms be na we feel say ojon so kra na say eba ku and I say ojon so no we feel say bia eden ebia kem and this what shima and sana insu Johnson I eden aba. It's all because of say your day obstruction ewa ha and I no eden ayena kakra. Ntu starting who say me Johnson we feel say bia kem this me shima and sana aba and I say Johnson abon say enshana ma eba ku and I kakra bia na Johnson ba ya enche bia na wo say ko bi because ebisa eden as I came. Pacho what you say. So there are these 4 symptoms I'm say. 1. Say Johnson intend maybe wako Johnson enche bia na wasa akodun so bio enche bia na wasa akodun so bio and I say Johnson no we feel say Johnson ase ni na ba ase we feel say bia eden ebia kem and I say Johnson enhye na ma eba keten and I say what chima and sana eden and sana ba no adwan ko say there is something I also eden obstruct hanom pachomatia say common symptoms of prostate in patients that are affected no some symptoms na eden e dey sha say more pachomatia say good. So now BPH benign prostate hyperplasia na mechichim no eno nkyere say eden cancer. The only way to differentiate ni under microscope no akokohwe sizes now increase in number, and I said there is changes in the structure. There is changes in the structure. Most likely it could be a cancer, but increase in number and interest a cancer are two different things. I am managing it differently. But what I say, but I'm not for be because we prostate. One imagine say a prostate cancer, and so any answer. What I say, that you ain't do be an old day. Okay, so what's the symptoms of enlargement? No, because say Nina like it's the same thing that happens at the narrow. You know, symptoms in there are the same, but maybe cancer no be additional more symptoms. Because in so be our cancer usually no so yede no so tiana oye kese. We be cancer baby o so tiana oye kese o so ti. Ana me boa. We be cancer oye kese da. Okay, good. So obi betimanya BPH no say ya prostate cancer at the same time. Another function of the prostate is say it produce a hormone be a friend no prostate specific antigen PSA. You know say do one phone mo call hospital like say we also your lab PSA prostate PSA. Me go anamu nye bi da. Why na ye bi da wa ha? Eh obi anye bi da. O go check in. To check we dey da. Yo, na ye. So in prostate
so that 30 minutes to 1 hour cra na just on the wa na feni invite to say minim say don't know can one some there
on the scan
okay
scan no the intel omo ye ne say omo se omo hu don so a etimi we dey accumulate in the bladder but what you say omo wi na omo adwon so no ma say hwe say bia kama e bi ye den enka mu on to omo ye pre voider and post voider urine on sinambo hu amount no into do so we no mo scan no say bebre woman most likely say there could be some obstruction so on picture we on baby na me chichi no prostate no on baby a gata na efriba from balloon na adwon so free mu no e ba kopem baby a obema ne ba no nti prostate na enlarge wa ha obstruction no nti picture we on say we a normal prostate ba on say we prostate na e den aye kese nti aye kese no on say gata no on say gata no e close ba nti the more ebe den ebe kese no na e den e narrow ne ba what you say. Okay, so now nipa saying and our age group bena almost 10 year prostate conditions no apart from prostatitis in the inflammation then the young boys can in saying in no because yes sexually active in some man infections young people ninya no more saying elderly no but about say BPH ni prostate cancer na young people from the age more than 40 no omo at risk of getting those conditions nti you will be your friend risk factors and you say e wo ha obenye bi but who meet this condition the likelihood of you getting that thing high patch what you say nti your risk factors are you group it into modifiable and non-modifiable risk factors. What it means is that modifiable, so we to my head, we to master son, and I'll be to my BBI afa home. Non-modifiable, we they are that's what you say. Into the 40 years and above, or at risk of getting prostate conditions, maybe the prostate C and BPH, you know. We better change age. We they are 40 now, we are 14. Unto me, Castle, son of Baba Yakura. This is how we are and I say who say, in blacks. As compared to whites, we get the prostate conditions much more than whites, where they are with more than a bruni. Until me, but what I say. And he say, a mood day now with me be a phone, a mood day risk factors now, how bit may be a phone, and only say, well, in power, who say, almost sono, like obese, no be my more than 30, no, or more at risk of getting what prostate is. Into also. So with my exercise, I'm also at it, and I'm a boy. I know to me be for home. But what I say, when you see who say, one mute deep processed meat, and now my process no. More at risk of getting the prostate cancer. So also with my be found, with my decided say, oh, deep processed foods will be now a risk no so I then, and so at it. But processed meat say sausage GB. Me ka say this stage o me come asem me chichi matchro. We ka say doctor ka say me do prostate me prostate cancer. And yes I dey here. So what you say? Aha. So BPH can affect about 50% of men over 50 years, affect 40 to 50% of men of age 51 to 60, and also affects 80% of men over the age of 80. Until with this age group, now you can say, oh, that the abami consulting room. No, I catch him say, oh, or John or bread. Or starting kind of when you say prostate and why then and why biasing because in the age no or me it is our age no. But young boy to say me no consulting room about doctor I say oh me chema and me can say obi like prostate cancer and I mean just animal because you don't fall in that age group. In medicine we say there's nothing that can't happen. Because to me, she be air out of the blue once in a while. That's what I say. But young people don't get prostate CSM or benign prostate hyperplasia. That's what I say. Okay. So now, can BPH or prostate hyperplasia can it affect the quality of life? Yes, it does affect the quality of life of a lot of patients. Because Uber consulting room be now almost 90% of like old people above the age of 40 or almost the condition ever. Most of them, like 90% of them, you say, oh, prostate, and I can't say more prostate, say, not to do so, but in your biopsy, this animal, and my advice would be, I say, what prostate condition be a catch your doctor, say, we are willing, so bad and obey a biopsy. In the outside world of butchery, above the age of 40, they are starting with screening. They started screening who in them, and they are starting heading, treating in them. I am trying this. I'll quit chili. See, never say, doctor, first doctor, miracle, and yes, I need it. Miracle, miracle, be a what I say. Please, any question before we continue? Any question before we continue?
What now, Kano, Brofono, but say, oh, boom, Kakra. Now, I can't say, Uncle Hospital, Uncle check him. I didn't wait now.
Okay, so, me say, screening, HSA, young funny say. Area no, but maybe may check up. And yes, may you me hospital, but may go hospital. Send a doctor be me. I am a check up in general, not because I me go hospital. It's because say, oh, go hospital. I say, oh, doctor, my ba. But yeah, maybe 3 months and 6 months. We are saying me buy day, me buy a check up. Or no, based on who age no. But say, oh, we also me show we kakra. We say me show we kakra. Me show prostate no so. We no so was screen. We akwa lab kakra. Akwa ultrasound kakra. Now, your lab no one say, oh, levels in the air cosora, which must suggest say, oh, in your biopsy, and share the air coso based on the symptoms now also the one. Most of the time, so, Nemo in a feeling, but Yadri any day, and Maho, this is maybe a doctor, but sometimes, like, symptoms do Mukaba, my dream, which means I say, yeah, me a doctor, my dream, Maho. Like we were pointing out to you, until we were hospital, maybe I say, oh, I have just 110. I say, I'm just 110 now. Oh, I say, who said, when you so quiet and shut up, my disability, Chairman, I draw attention quiet about so much. So, doctor, I requested investigation concerning that side. No, don't say, I started management towards that side. That's what I say. Could be self judging, sir.
Dr. My patron, my son said, now what can be said? Obit Mina BPH, you know, I say, now cancer. At the same time, I can't. Na cancer no kwakura wunya ehu na BPH ne kan ho a I don't know na condition that we say.
So the BPH no I know chile say like histologically when say empany say belakwa we am okay in one box eshemu 12 that's the normal but a ba say na belakwa wo she box mu a eshemu be 18 na when say abnormal quantity na then I increase. Say increasing in size, and a friend of being hyperplasia as I increase in what in number. That's what I say. Say cancer no so. I said 12 na but more architecture no different from normal. That's what I say. Into uko fa belakwa, but no so easy. But uko fa na amwamwa. No abnormal. That's what I say. So which man I say oh increasing in number, but it be so then amwamwa. That's what I say. So the fact that when you BPH just say cancer so which mean you cancer without BPH, which mean you BPH without cancer, which mean you pneumonia because the problems in the beginning because I say prostate or very different parts. Cancer may affect specific parts and a BPH will affect another part. That's what you say. They arise from different regions. That's what you say. Yes.
Masemusa say so uche kwan fa so ayenya saa ya de no. Matise bizusu say uye adwuma wo tatena se cha elusu e ma otumunya saa ya de no kure.
Oh, there it. And the risk factor for getting state conditions and the no correct.
But Miss Massim Bisana say do baby na say what Johnson be by yellow. In the Binsuba said the no at the paper or no me. And no at the say a cancer and I say a PDS.
Okay. One time I would Johnson one about yellow, one about different
Johnson be or her.
Okay,
but Johnson white. You must be one with me by yellow.
Okay, so there will be a fair hydration status. A day, ideally also to should be at least 3 liters in a day. And no help you flush your kidneys. If you know kidneys in our toxins, now kidneys in our head about one thing. One woman so be urine air concentrated. Air concentrated and by yellow. No, you to buy a deeper now. I say like orange. But one woman so be so to buy a bear clear cry say in sui. But what I say, so it reflects in sui onum in a day. But what I say, I doubt unum so pabo so urine in a day in a fair. I doubt so unum so which by as deep as even orange. But what I say, to so just a yellow. I only Arabia. It just say, oh, so baby, also so baby. By your other conditions, we say, oh, hepatitis and now liver problem. No, so you might so a deep. That's what I say. But normally, a yellow ness had and I say, only shall a numun so baby, also numun so baby. That's what I say.
Yeah, Ghana doctors no. Oko kan was on na be kire meduma. When you yadi anka, what an antito, and because it another make a meboa. Okay, we was other wouldn't more yadi other than what they buy. And the Amagana Hano, you call hospital into me, MCBB, said Doctor Mpesenka, me I check a chrome, I check pass, I'm a name with dark when I'm a juma. And I'm a call doctor naturally say, one year me lab now or charm with dark when the man. When I'm so, Doctor, if you recent car. Could test me more jaffe. Next, no crown and bufu more. I then I mean, I'm a better doctor Nejuma. No, the doctor and Yamiadum Yamekana command so and yes, my mentry. And to me, quite a lab by no chance. Oh, the brown can have a mini say. The brown can and no credit. I drowned my resistant M1. And he was asked a side drone. The next hour, the bed and a doctor, you get Marco Canton and Bethany.
Doctor, you may a double trainer. Means being Kasama doctors bia, but the patient is always right. In a sense, say, oh no, about Hosabuano. So now how they be to me, no, so person or yes, artist, and why not? Oh, and you want to be to his scanner. Maybe Miss Makacho say, oh, based on the mehono, maybe a moon here, but person yeah, and no air fine is within your right. But mean to me, say, why requested me yamau and I be sir, and I maybe make you much or at the Quintia, we are M1 and I at the Quintia won't mean yet. I mean to me, what can say, oh, baby, you know, I say, oh, no, about me, Chimuncho, and I be sir. That's what you must say. But who doctor, how I say, oh, doctor, oh, now, but check up the announce, oh, send me check my prostate, oh, maybe in a respectful way. That's what you say. Now maybe we can move on from there. Ideally, you listen to you, he has to. It's his job to listen to you because you won't know your home. That's what you say. Any question? One more question here to us. Yes, I bet you we are near 4 questions.
The maybe son say. You would do I will do baby a one or for more.
Okay, you do it. I will do it. Why? At this point, I make what you eat, Matwaso. Okay, so good. So, a year day, it's me a day. Who say Obi prostate condition, BPH, what prostate cancer in the Sanya Manabi. Nina started from say only Pacobe day, a new como. The Pacona more information, or doctor, no bed day. I interpret an own. So, only any day, a casa, and a friend from what medical history. Into any patients in bed, a casa. No, I can't complain at show. What mean can you at times when I was ubisa, so you can get that information because I'm banana refi. We bet you about consortium about all the qua. Hey, Doctor Makai, oh, we cross our hamu and I okay and oh, we or Doctor Abgomio, refi. Until you becoming now, who was a doctor and also bought patients and so no binya high information out of the bed, would be humano. And then friend what medical history. Now history, taking a good history, it means like about 80% of your diagnosis. That's what I say. About 80% of your or even 90% of your diagnosis comes from what history and physical examination. When you have correct information, ultimately interpret and my results, input and what and output. When you have good input, when you have what, when you have exactly no bad input, bad output, good input, good output. That's what I say. So taking a good medical history is what is very very important and what examining the patient. Since the patient about how much as a doctor, then say. Me Johnson 10 pa, you may be I'm sorry, my Johnson be 3 times. Me Johnson I'm mushishime. Now sometimes so me Johnson I say me chimpa and son about me bro, me brenti boame because you daddy mate. Now daddy, na obusheni obi o prostate condition be and I say prostate cancer. One thing I'm forgetting say me adding say obi prostate cancer in the maybe in the family obi prostate cancer and the generations more at risk of getting that what cancer too. Genetics. That's what I say. Your genetic mutation be from the BRCA gene and Lee-Chan syndrome and other things. You are at risk of getting that one too. That's the prostate cancer, not the BPH. That's what I say. Yeah, and say obi cancer obusu and now my cancer. You too are at risk of getting that what cancer. Like likely you can get it is actually high if it's in the family. That's what I say. So you take a detailed medical history into in the history also bisa abusu no bi o prostate cancer and will be your prostate cancer. I mean some hospital be some salmon sensem. And because pressure also na bu woman and our papa or pressure na obusu ni bi o pressure ni na ebo ma hu sequence of events and say na ebebo. So after that who examine the based on the pakona catch on who suspect say pakona or prostate condition there. The only way with me examine prostate only one way pay because the prostate no inside no. I mean go back to picture it. Good. Who say baby a prostate one or hana erectum or baby a like vagina efiba hana efiba baby a oto one unti oto one e fa de say e kosoro to intestine inti the only way I bet me examine prostate now inside and say this area inside there if I start to room near the appropriate what prostate no meaning say more prostate condition ma hospital doctor ka say oh person dey show to kakra person checking him and maybe prostate no person dey or check and ask me who hemorrhoids but most of times or the inside show to check prostate no but what and your compulsory say waka say obeye which make I say oh umpe but idea ebeboa no oya ebeboa idea ebeboa patch what you say nti obetiki permission no or the gel kakra at the film no or they check it prostate no say problem on one and problem no but say advanced methods will be aba it mean just scan dey emo but if I can't be for this scanner oh doctor dey na obeye. The only thing is to perform what a physical examination. Once a scan so operator dependent, we with my but the only objective way to do is to actually what feel it yourself. That's what you say. So that's one way of investigating for what prostate condition clinically based on physical examination about lab and scan be any day MBM. So that's what we call the digital rectal examination. Digital means using of the finger. Rectal means inside the rectum examination to examine what's the prostate. DRE. So another way it means check say prostate issue and say they're not the so it means now I say my Sunday for about an hour or two no more. After that now some IV medication be a contrast and yeah old so I no more send me at any air there was scans for no that's what I say. So what are some of the treatment options? Say you treat prostate conditions your treatment options will be based on the area either say prostatitis and a BPH and a say prostate cancer the management here different. Say prostatitis infection there cause say an amount of antibiotics based on the cause. The more antibiotics now not on but BPH now because say idea grow the cells are increasing number And what we can do is that a bit mama will do ever stop it what rapid progression of increasing in size, no. And the other thing is as a good doctor, the patient about with a symptoms at the end of hand into no day, into no buy at least our symptom no addresses our symptom no. Say want to be in so if you say a BI day, a BI came. Until we show picture we are. Say David, let me use it. We show picture we are. Once I no process na there, I enlarge and a hand so I then air block it you will do be a demawa a bit me I relax say a high uterus no. Am I more big a crass and ya obstruction a bear less. No Johnson I day 8 me aba. But what you say? Inti a very relax say a muscle sphincters no. Sunny Johnson a bit my day aba more. But what you say? Inti do I friend tam solution. You say a bimu edaso. You can say I num de enyumre. The be about 400 micrograms. Near Casafan enyumre and no boy release some of the symptoms no. But so who say any progressive usually you will do this why it's minima finasteride. But before some make finasteride no some tam solution and also side effect. It do be unu so be cry was side effect. If you see be was side effect. Which man so be cry bibia was side effect. Para away it was side effect. Bibia was side effect. But advantages no but better than what the disadvantage. Say I there how na eboa na me say me mo say edu na make sure say edu we etimi ko suwe. It will lead to the question say me we ebisa me say etima ahoden ba from this. I no etima like wahon dey den eba from kakra be me intimi gina so yi decide on your mawa etoda in say etoda dey bia e do bi ka ho say na e be boost this aspect no because ha member be because of enokra member be emphasize do no because we say onom side do na obe emre okufia the wife be complain inti na me say a good person man so abaha some beti ase pacha what ase okay so another drug near finasteride. Finasteride no inhibits hormones na emma proliferations no eba intentem no. Sani a slow progression of it no. But you know in time this is an indication to give. Good. So the treatment options no, your conservative treatment, your medical treatment, or surgical treatment, So depending on the severity of your symptoms, usually there's an international scoring system. You do who say we mild symptoms and a moderate symptom and a severe symptoms. Based on that, you choose you be conservative, you be medical and I be surgical based on the symptoms or the scoring system. Say mild symptoms na share how baby usually because watchful wait, maybe wait by reverse, maybe wait by progress. That's what you say because a do I remember maybe the effect won't mean withstand it. Mild symptoms but say moderate symptoms which must start medical treatment. I'm solo saying I can and I can try this animal and you will be senior bed to my boy. So if it's mild, you don't need surgeries or even medication. So with lifestyle modification, the risk factors now one. So we can see I know start here then exercise I can send you also better maybe that risk is why then I'm not so So a drug I'm kind tamsulosin for me under alpha blockers. It's intended for men with mild to moderate severe symptoms. It provides relief of BP symptoms. It works almost immediately, but the side effects because tamsulosin needs to drop blood pressure or emanoko form. Into more that blood pressure do no so. Mama say no na ye hwe sa man and say ya BP nko form na rush back to hospital say BP or form or ye no sa man ya just some medications but what I say. Your medication they intimate combined with tamsulosin. Because they work at the same level. How much about drop blood pressure significantly. So it can cause dizziness or fainting, fatigue, nasal congestion, abdominal ejaculation, and other side effects. And finasteride na meka is intended for men with demonstrable prostatic enlargement. It reduces the risk of the need for surgery because meet me in wakasa. I'm say, ube here surgery, but wakasa doctor, me surgery. The other options we are there. Timothy Makacho so ndro but indonesia ya na efilia e be say about to surgery but you wait about try unyanyame but you wait to give that option to the patient for the patient to choose until force patient so yes wait to advise patients but it's up to the patient to take the advice or not take the advice. So take care everyone one take and one document say, oh, see, maybe it's your bad one, son, Adrian, no more put us with you. Good. So for that, the other effects, erectile dysfunction, and a lowered sexual drive, and holding anything about from. Good. So, say, medical treatment, no, your mom doing Rosa and Yejuma. Yes, Yejuma. The other way, say, bedding, you say, I say, me and my house job, 2022. Papa by me consult room, we did 80 years. Or by na yehwehwe mu a na or prostate cancer. Nti e ka say nnuru de enye den emmo nanka surgery na be den e be boa no. Na obey surgery bi a also explaining complications of the surgery e kire nipa kro no. Se ne a esika onka say e ade a wa surprise na wan kan kire no. For every procedure you do, you tell the patients the advantage of doing it and the disadvantage. Nti e kire mu a na e do disadvantage ka say e be do maybe ne be ma sorry. So any on ye 80 years also on ye or then the hell the nunkuno or say cancer nunkuno okay so my answer so this is just by the way so I best anyway so Pacho, my answer. Okay, so for surgeries, for surgeries, your surgeries are hold up baby. Your something we call minimally invasive surgeries. If it's a minimally, it's idea young like young pipe and say idea maybe from a distance or without actually significant introduction inside or the pelvic region. That's what I say. They are minimally invasive. So usually there is with the microwave ablation of maybe the cancerous cells that are there or other things, and in advanced world, I had maybe hospital back maybe Kolibu and your friends in Confanoche and UGMC. Option no because maybe we surgery we paying but other options will have met my day. The other options in we type a transurethral resection of prostate. Now we me teach him I have because the surgery no one yet. The BN say surgery no the before obemum, the be raw obemum, I could prostate one. I see A. Anti on picture way. Picture way. Yeah, the be before obemum say near alcohol, na prostate no baby a anaro no. Na dey near twa, has near twa. So near a have a day, a be free. And a friend transurethral resection of the prostate. That's another way of doing it. The next way they say your open prostatectomy. Now open prostatectomy no. Say no. Okay, let me use it. Open prostatectomy no. Say na make say baby I don't want sa ebe hwe prostate no. Or why you be twa kakra. Say na be access to the prostate no. Me then me twa free. The more invasive it is, the more the complications. Until I say, "Be try kuma." Answer ni be do. There are other structures I wait my then, wait my damage. That's what I say. Transurethral no is much more safer than there was the open prostatectomy. But there are any advantage, no disadvantage. That's what I say. It is our option also person yes I say we now. Good. So the open prostatectomy does it. It's typically performed for patients with larger prostate volumes of 80 to 100 ml. Effective for men with very enlarged prostates, bladder diverticular and stones. It's associated with longer hospital stay because it's more invasive because it reaches other structures. Because say a baby infections baby so bad a bit messy. So risk of blood loss because of vessels now transfusion significantly greater than transurethral procedures. Good. So, for every issue that's wrong with you, the best next step is what? Consultation with your urologist, required to determine what therapy option is best for you. The fact that say when you have small information about prostate conditions, maybe what you do where you want to say pharmacy, say the best way is about hospital, not doctor. So what's our problem? And I only say our problem now. Much I say. One more thing I'm saying, I answer my question say. more prostate issues no usually BPH ni prostate cancer no ya urinary tract infection. Urinary tract infection is different from sexually transmitted infection. Now, more hospital kasa o infection ana wa bia say onu bi akwa na there be any infection. Your infection na unya no urinary tract. Urinary tract kire say bi a ojonso form na kwan na e fa ne ba no. Infection na den abem. Won say o prostate condition na se na e chichirim tire say e kwan ne block na nsuo no ye den e gada wa ha on. This one so gada wa ha ojonso mi na e fi na wo on. Say gata choki bebria e dey na ba so. Say gata choki e cha dey na ba so. Bacteria na mosquitoes ni other things e ba ho. Sa so your system so tie. Say gata no choki a na ojonso no choki a e da ho cha na bacteria start to produce wom na cause what infection. But what you say into more prostate issues na bebria na or UTI so more what infections or mujunso we call hospital like infection or mujunso then cause infection no. Another thing is this prostate condition BPH no and an enlargement on any obstruction of the urethra no can cause you to have a kidney problem. Apart from hypertension, diabetes are common like in this our community or this country. The most common cause in our setting is what? Prostate conditions. Because say where do you think it will go? It will go back to where it's coming from, right? Say about urethra na maybe a kidneys to say a shake kidney no na start inject kidney no. Say any friend or sometimes pyelonephritis. Now pyelonephritis they causes carrying to the kidneys, now damaging kidney over time. Now cause you chronic problem. Wait more damage kidneys say kidneys no can yejuma. This said to dialysis and I owe in transplant. Then you have hypertension, diabetes, any other condition can cause kidney problem. Now prostate and cancer will cause what? Kidney problem. Pacha, what you say? Good. So the takeaway message for today is that more and more them will be away 40 and above Pia or China. Kubuki appointment who doctor. No examine on so prostate condition be only prostate condition be. Usually the first thing obey after taking the history and examining you say we want to lab be a friend PSA. Now PSA no normal from 0 to 4. Anything below 4 normal. Anything above that is high. But there are some things I will my na prostate PSA in the eye then akosoro. You might say doctor then say show to me prostate na no stimulate PSA ni bi to man akosoro. Nti ko lab na wo so kra the examination na man eye then akosoro. And yes we prostate problem. Nti before so e be ye PSA ni e be fa sample no kan say na ordinance akwa kwahihye to. What I say. Okay. The next best thing is obey ultrasound. So your ultrasound no who say suspicious with the history. You are saying like ujonso humoja womb. Ujonso no humoja womb. It's more likely say it could be a prostate CA if you have the symptoms of the obstruction. What I say. Or best say munkoye biopsy. No akone atu kakra ne da collab ne akohwehwem. Ne akohwehwem say cancer ne starting managing. One more important thing, BPH no. The most like debilitating thing about it is because symptoms now we feel maybe so yes and many infections are being is manageable than prostate cancer. Iron chinente. When you prostate cancer, a bit to ako baby, a beba spine with mako or how a bit more bones means are spread it. At that time now too late. But what you say into watching in time next started treating in time. You know what? In your good prognosis. One advice I made by including myself, and he said, and change obey Yaraka, obey man, me a bear man, where the intimate hospital, where the main hospital. You are causing harm to yourself than good. Until Uba hospital be na like a financial bar, Mamba hospital does the same member because the man will be a quaint or cut about hospital, Bema can say me a bear man, me Africa, Mweding. So now we'll cause harm. Pachomatia say, Intim Pacho. Mass asking could to send me a bear am where they meet the fee, there be a yanasa. We begin to be a hospital, be your chin in Tema. Management is simple. Pachamatia say, your chibi be an Tema, management is simple. But soon, China, they will no hospital, opposite Dr. Magic in Sisa. Pachamatia say, to me means MBC. May receive questions about 10 questions, not Yakulusi.
Asi bebree ne afutu ade amaye na me question di titia se minum nso bebree a ma me dwunso ntententem pa nti ya na ma me penso num pi na filmi hu se denti abeka sa me driver ni drive ko lonjani denti ma se 30 minutes bi awa jina sa me dwunso ti de ya ne se nso mi so num se no ya se anen koyi no Susan so boni bi wana be feda mo
see onu so bebre not it's not necessarily always say obedun so bebre what I say it depends on the amount nti e dey onu be saying how many like pure water onu like pure water be saying and what it got to be
saying obi ka pure water no anu ni nyina aha like me yesa Tizawa ya 30 minutes bi a me jina sa me dwunso.
Nti e dey otu no be essence happy water no.
O e dey me manuma bi a 4-5.
Be 4-5. Nti pure water ba ko bi a 500 ml right. Nti ono be 4 a say 2 liters. Ono 5 a say 2.5. Nti one advice I be man say your body no smart. Wait smart na say. Your body no smart pa say in this weather condition, because of the cold weather, no, your body lose fluids not only through the urine but through other places too, like sweating. But so if you have baby, I want to say, where then, baby. Same period, I want to say, don't society. But in this cold weather, the only way our body to be excreting some fluids here then through jeans or no. Nti won notice here say cold weather ba udun so bebre say maybe say we are put abo mesa mama advice say ubenu so bebre ka taking throughout the day and normally in the evening what I say because in the evening you don't have any activity best say one na or stress level because so your risk of hypertension so bad then because so what I say so ubenu so bebre in the morning afternoon towards the end of the day I will no drink as less as possible. In case I know which one but because of me koda or take me inside so be 3 times so kwa so what I say wow ni body
Dr. Leon what was in say mechanic air condition car VIP bus nti unse no so kan bi na menum so na ma me ju so bebre
Doctor.
Yeah, exactly.
Obi say unya says ya ema the probability to obina prostate cancer as